Rest absolutely has a place, especially early on. But when rest turns into prolonged avoidance, the system can become more sensitive and less tolerant of activity. Are you ready to get back to what you love after knee replacement? The Total Knee Success Podcast is your trusted guide with practical tips, evidence-based strategies, and no fluff. It's not personal medical advice, just solid education to help you manage pain, regain mobility, and get back to living the life you love. Let's dive in. Welcome back to the Total Knee Success Podcast. I'm Michelle. If you've been dealing with ongoing pain after knee replacement, it can feel like you're doing all the right things and still not getting the response you expected. By the end of this episode, you'll understand what actually helps reduce pain and how to start applying it in a way that works with your body. This is the third episode in a 4-part series on pain. If you haven't listened to episode 63 and 64 yet, you can always go back after this because they build the foundation for what we're talking about today. I want to bring you back to Linda, someone we introduced earlier in the series, a made-up patient we used to help walk through what many people experience after knee replacement. At this point, Linda has started to recognize that she may be in a loop we talked about, where fear, tension, and pain are feeding into each other. So the question becomes, what does she actually do about it? This is where a lot of people get stuck because the instinct is usually to do less, to rest more, or to avoid anything that might increase pain. And while that seems logical, it often doesn't work the way people expect. One of the most consistent findings across research in knee osteoarthritis and after knee replacement is that movement, when done appropriately, is not the problem. In fact, appropriate movement is one of the most important tools we have for improving pain and function over time. There's even evidence challenging the long-standing belief that exercise wears down the joint. Instead, exercise and activity, when done appropriately, do not appear to harm the knee joint and can support better outcomes. So the goal is not to eliminate movement. The goal is to change how you approach it. Let's walk through what this looks like. There are 5 key strategies that consistently help reduce pain in a way that works with your body, not against it. I'm going to walk you through each one, and as you listen, you can start to notice which ones apply most to your situation. These strategies are consistent with what we understand from modern pain science about how the nervous system responds and adapts. They're not about forcing your body to change. They're about creating the conditions where your system can start to respond differently over time. These are also the strategies that begin to break the cycle we talked about in the last episode, the loop of fear, tension, and pain. What breaks that loop is not doing nothing, and it's not pushing through everything. It's changing how your system responds. Here's what that looks like in practice. Some of these strategies overlap, and that's expected. You may hear one and think that's exactly what I've been dealing with, and another might not feel as relevant right now. That's okay. The goal isn't to apply all 5 at once, but to recognize where you are and start with what fits. The first strategy is shifting away from an all-or-nothing approach. This is one of the biggest patterns that keeps the cycle going, doing too much or doing nothing. What often works better is finding a middle ground, where your system can start to adapt without becoming more reactive. For Linda, this showed up with stairs. She had started avoiding them altogether because they were uncomfortable, but avoiding them completely meant her body never had the opportunity to adapt. Instead, we look for a starting point that feels manageable. That might mean fewer repetitions, a slower speed, or using a handrail for support. This is often referred to as graded exposure. You're not forcing through pain and you're not avoiding it entirely. You're finding a level your system can tolerate and gradually building from there. Over time, this helps the nervous system become less reactive to that movement. The second strategy is calming the nervous system. If the system is more sensitive, then part of reducing pain is helping it feel safer again. And just to be clear, this isn't about you being a sensitive person. It's about how the nervous system becomes more reactive after surgery or ongoing pain. This is not a judgment of personality. And this is where understanding what's called the sympathetic and parasympathetic nervous system becomes helpful. When your system is in a more protective, high alert state, the sympathetic side is more active. When things feel safer and more settled, the parasympathetic side becomes more active. I'll explain how that works in more detail in a short educational download I've put together called Making Sense of Pain After Knee Replacement. But for now, just think of it as your nervous system shifting between more on edge and more settled. What we're trying to do is shift that balance. Simple ways to do this include pacing your activity, reducing constant monitoring of your knee, and using your breathing to settle the system. A practical starting point is slow breathing through your nose, in for about 4 seconds and out for 6 seconds, for a few minutes at a time. If you want a more detailed walkthrough, I go through some breathing exercises step by step in episode 12 of the Total Knee Success podcast. You can check it out when you're done here. For Linda, shifting that balance meant setting specific times to check in with her knee instead of thinking about it all day long, and using her breathing to settle things when she noticed tension building. That shift helps turn down your nervous system's reactivity, so movement becomes easier to tolerate. The third strategy is consistency. One of the most common patterns we see is doing a lot on a good day and then needing to pull back significantly the next. This is often called a boom and bust cycle. That up and down pattern can keep the system more reactive because it never really gets the chance to settle and adapt. What tends to work better is a more consistent approach, where the amount you're doing is something your body and your knee can tolerate day after day, even if it feels a little slower at first. So what does that look like in practice? For Linda, on days she felt better, she was walking 30 minutes and doing a full set of exercises. And then the next day, her pain would spike and she would skip everything. Instead, she shifted to 15 to 20 minutes of walking and a shorter exercise routine she could repeat daily, even on days her knee felt a little more sensitive. When the plan feels manageable and fits into your routine like that, it becomes much easier to stay consistent, which is where progress starts to build. The fourth strategy is using rest strategically. Rest absolutely has a place, especially early on. But when rest turns into prolonged avoidance, the system can become more sensitive and less tolerant of activity. So instead of relying on rest as the main solution, it becomes something you use to support your activity, not replace it. This is also where things like heat and ice can be useful. These can help settle symptoms temporarily, but they work best when they support your overall plan, not replace movement entirely. So what does that look like in practice? For Linda, she had been spending long stretches of the day sitting down or lying down anytime her knee felt uncomfortable, hoping that more rest would help it calm down. Instead, she shifted to shorter, planned rest breaks between activities, using a few minutes to elevate her leg or apply ice, and then returning to movement before stiffness and sensitivity started to build up. Using rest in this way helps support recovery without letting your nervous system become more reactive to movement. The fifth strategy is learning how to respond to pain in a way that supports progress. Pain is real, but it is not always a direct measure of what's happening in the tissue. So instead of reacting by stopping everything or pushing through completely, you adjust. So what does that look like in practice? For Linda, if her pain increased during a walk, she used to stop completely and avoid it the next day. Other times, she would push through and end up more flared up afterward. Instead, she began adjusting in the moment, slowing her pace, shortening the distance, or taking a brief pause, then continuing at a level she could tolerate. Over time, this helped her build confidence with movement and reduced how reactive her system was, because it was no longer swinging between extremes. So when we put all of this together, this is how you begin to break the cycle. You're gradually showing your brain, your nervous system, your body that movement is safe and that it doesn't need to stay on high alert. This is not always easy, but it's doable. I help people through this process all the time, and you can also get support from a physical therapy professional who's trained in pain science and can guide you through it. The goal is not zero pain. I guess, tell that to your knee. The goal is to retrain how your system responds to movement and daily activity so it becomes more predictable and less limiting. If you're thinking about your own situation, you might start by asking yourself a few questions. Where am I avoiding something completely that I could try at a smaller level? Where am I doing too much on a good day and paying for it the next? What is one activity I could make more consistent from day to day? Those small adjustments can make a meaningful difference over time. And if you're not sure where to start, go back to the strategy that felt most familiar as you were listening. This is usually the best place to begin. If you're interested in going a little deeper into this topic, I've put together a short 30-page educational download called Making Sense of Pain After Knee Replacement. It walks through these concepts in a little more detail and helps you understand how to apply them in your own situation. You can find a link in the show notes if you'd like to check it out. Before we wrap up, a quick safety note. Most of what we talked about today reflects normal patterns in how pain can behave after knee replacement. There are, however, situations where pain may signal something outside the usual pattern. Things like increasing calf pain with swelling or tenderness, shortness of breath, chest pain, a fever, or a knee that is becoming more red, hot, and swollen, instead of gradually settling. These can be signs that something else is going on. If you notice these kinds of symptoms, it's important to contact your surgeon or medical team so they can evaluate what's happening. Next time, we'll take this one step further and talk about what's actually possible when it comes to changing pain over time. You don't have to apply all of this at once, and small changes in how you approach things can add up over time. Thanks for joining me. I'm Michelle, and this has been the Total Knee Success Podcast. This podcast is for educational purposes only. Discover more at totalkneesuccess.com, and be sure to subscribe and share, because every step forward takes you closer to living the life you love.